quite a number of the dignitaries who are already present here who want to use the opportunity to please recognize some of you.
Distinguished guests, ladies and gentlemen, good morning once again, and thank you for being here. Thank you for your patience. Just to recognize and welcome a number of people who are in our midst, would like to welcome the representative in no particular order now, the representative of the chairman and director general of the Nigeria Governors Forum, Dr. Ahmed Abdul Wahab, who is the Senior Health Advisor at the Nigeria Governors Forum. Thank you so much, sir, for being here. All right, okay, so we see you there. We'd also like to welcome and recognize Mr. Abubakar Isa, who is the Director ICT and the Ministry of Education, and he's representing the Minister of Education. We welcome you, sir. Thank you so much for being here. Please, a round of applause for them. Thank you. Would also like to welcome Dr. Bala Yusuf Yunusa, Senior Technical Advisor, Office of the Senior Special Assistant to the President on SDGs. Thank you so much, sir, for being here. I know you're sitting, yeah, there we are. You're welcome, sir. Also like to welcome Dr. Leo Zekeng, Country Director and Resident Coordinator of UNAIDS in Nigeria. Dr. Leo, you're welcome. Thank you, sir, for being here. Dr. Samson Ezekai is representing the country representative of the United Nations Population Fund, UNFPA. You're welcome. Thank you, sir, for being here. Would also like to welcome Dr. Claudia Vivas, UHC-LC Cluster Lead at the WHO. Thank you so much. She's representing the country representative of the WHO, Dr. Walter Kazadi. And one of the reasons we're here today, he's at the helm of this, and also so glad to be launching the NICS as well, the second time around. Would like to respectfully welcome the Executive Director and Chief Executive Officer of the Nigeria Primary Healthcare Development Agency, Dr. Faisal Shuaib. Dr. Faisal Shuaib, you are welcome. Thank you for being here. I know there are quite a few others that we need to welcome, so I'd invite Nuhu to, take charge from here. I see quite a number of people in the room. The Permanent Secretary from the Ministry of Health, Mahmouda Mamman, represents the Honorable Minister of Health, and we're grateful to have you here, sir. You're welcome. Right.
Thank you very much. I allowed you to deal with those in the diaspora because you were brought up there, but me, I'm fully homegrown.
I'm homegrown.
So I will deal with those at home. Permit me, ladies and gentlemen, at this point to welcome a very important personality, particularly to the National Bureau of Statistics. I'm talking of the chairman of the governing board of the National Bureau of Statistics, Dr. Kabiru Nakora. So you're welcome. I will also, in the same vein, like I said, going home, recognize, seeing this as a product coming from the National Bureau of Statistics. Please, may I recognize all the directors from the National Bureau of Statistics. Please, may we be on our feet. Directors from the National Bureau of Statistics. Thank you very much. Dr. Marokun, you will agree with me. Hard work makes you use a lot of glasses. See, all our directors are using glasses now. Thank you very much. Please, may I also recognize all the statistician generals from the states. All statistician general and director of statistics from the states. Please, may you also be on your feet. Thank you very much. Gidado, I can see you from the Northeast. You're welcome. Please, our zonal controllers, please, if you are here, zonal controllers, the 6 zonal controllers. So you're welcome. Thank you very much. I don't know if the rectors of the Federal Schools of Statistics also come. Sir, you're welcome. Please, our sister organization, all directors from other MDS, please, if you are here, can you please be on your feet? I'm sure there's quite a number of them. Thank you very much. Thank you, sir. You're welcome. We shall continue recognizing and also acknowledging those who found time to be with us here. Like I said, any moment from now, we shall start. Meanwhile, my sister, you are welcome too. You are welcome. Thank you very much.
Also recognizing all our development partners and from the various UN agencies and other agencies. You're all welcome, and we look forward to having a great time. Hopefully, as Nuhu has said, we'll start in a few minutes and properly welcome and invite you all to be here. Thank you so much. Please stay with us.
Give me your ears, I know go back. Picking it good love and care. Kings and queens, leaders of tomorrow. Life will better if you pay attention to every girl child. Whether the healthcare, be the education. 'Cause I'll be small girl, oh, but I get big dreams. I am a child, the light, the dream, and the hope for tomorrow.
Thank you, the control room. If you don't take it easily, this is not a dancing hall. I don't want to start dancing here. So let me welcome also into our midst Olubi Olushayo, who is from NAPTIP. Mr. Olubi, please. You're welcome, sir. Thank you very much. And let me respectfully also welcome Dr. Mohammed Sakir Balogun from Afinet. Dr. Mohammed, you are welcome, sir. Thank you very much. Yes, you can continue with your music, but the one that will not influence me to dance, please.
Every boy, every girl, this has a future that is bright. But when we fold our hands, who is gonna shine the light? There is no better time for you and me to take a stand. So give love and bring hope to the future in your hand, yeah.
I am a child, the light, the dream, and the hope for tomorrow. The hope for tomorrow.
Announcing the arrival of the Honorable Ministers of Finance and the Minister of State for Budget and National Planning. Thank you. May we be seated, please. As I said, distinguished ladies and gentlemen, our hall is getting full, meaning any moment from now, We'll be starting. Let me most respectfully and in a very special way welcome our mother and sister, the Honorable Minister of Finance, Mrs. Dr. Zainab Samsuna Ahmed. Please, may we put our hands together for her? Thank you, ma'am. Always and always in the same spirit, aim at the same target, work together. Let's welcome also in our midst the Honorable Minister of State Budget and National Planning, Prince Clem Ikanade Agba. As they were coming in, supported by the National Coordinator of the Nigerian Statistical System and the Statistician General of the Federation, Prince Adeyemi Adeniran. Please, let's welcome the Statistician General. The country rep, UNICEF, Peter Hawkins, comfortably sitting directly opposite me. Please, let's welcome Peter Hawkins. Thank you, sir. Doing a wonderful job. Your Excellencies, distinguished ladies and gentlemen, I've just been informed the Honorable Minister, who is now representing the Vice President. So may we rise for the national anthem. After the national anthem, we shall remain standing to recite the second stanza of the national anthem, which shall be our opening prayer. The national anthem, please. We'll now take the national anthem, which is the second stanza, our opening prayer as our national prayer. 1, 2, go. O God of creation, direct our noble cause, guide our leaders right, help our youth the truth to know, in love and honesty to grow, and living just and true. Great lofty height attain, to build a nation where peace and justice shall reign. Say amen. Please, may we be seated. Your Excellency, the Vice President, Federal Republic of Nigeria, Professor Yemi Osinbajo, here heavily being represented by the Honorable Minister of Finance, Budget and National Planning, Dr. Mrs. Zainab Samsuna Ahmed, the Honorable Minister of State Budget and Planning, Prince Clem Ikanade Agba, Honorable Ministers of Health and Education, here being represented by their permanent secretaries, UN Resident and Humanitarian Representative Coordinator in Nigeria, Martel Samuel, the UNICEF country representative, Peter Hawkins, the Sergeant General of the Federation, Prince Adeyemi Adeniran, the DG here representing the Governors Forum, chief executives of other MDS here present, state statistician generals here present, zonal controllers, rectors of schools, UNICEF and other staff of development partners, management and directorate of the National Bureau of Statistics. Ladies and gentlemen, please pardon me as I skipped the chairman of the governing board of the National Bureau of Statistics. Sir, apology for that. Members of the press, other invited guests, distinguished ladies and gentlemen. Welcome to this very important ceremony, which is the launching of the multi-indicator cluster survey mix and the National Immunization Coverage Survey mix report of 2021. Your Excellency, distinguished ladies and gentlemen, this exercise, noble exercise, started as a modest beginning in 1995, covering less than 50 indicators. Today, distinguished ladies and gentlemen, we have passed through 6 phases. The second phase in 1991, the third phase in 2007, the third phase 2011, the fifth phase 2016, and the one we are launching today of 2021, covering over 200 indicators. Distinguished ladies and gentlemen, my name is Nuhu Wane II. I'll be working here today with Ian Ode. Please, Ian, over to the podium.
Thank you so much, Nuhu. My name is Inya Ode, and I welcome you all to this very important launch, as Nuhu has said. Quite a lot of things to look forward to, and one of the things we say in Nigeria that's always a setback for us is data. Data is so important for development to take place. Data is important for people to move forward. Data is important for one to know what to do per time. And that's why the mix and the NICs are so important. And we're honored to be part of this very important occasion. The mix and the NICs are led by the National Bureau of Statistics with support from UNICEF, from the NPHCDA, from Gavi, and of course, the Bill and Melinda Gates Foundation. As has been said, moving from 28 indicators to 200 indicators in the last 21 years has definitely been a great feat. And we look forward to the developments that will come through following the launch of these great tools today. With these words, I welcome you all once again, and we look forward to a great launch this morning. Thank you.
Thank you very much, Ian. Your Excellency, distinguished ladies and gentlemen, to kickstart this ceremony, it is now my honor to invite the National Coordinator of the Nigerian Statistical System, Chief Executive Officer and the Statistician General of the Federation, Prince Yemi Adeniran, for the welcoming remarks. The Statistician General, please.
Your Excellency, the Vice President of the Federal Republic of Nigeria, Professor Yemi Osibajo, SAN, VCON, ably represented here today by the Honorable Minister of Finance, Budget and National Planning, Mrs. Dr. Zainab Samshuna Ahmed, the Honorable Minister of State, Budget and National Planning, Prince Clem Ikanade Agba, all Chief Executive Officers of MDAs, ministry, department, and agencies of government here present, permanent secretaries, the UN resident coordinators, UNICEF country rep, state surgeon generals, the chairman governing board of National Bureau of Statistics, gentlemen of the press, distinguished ladies and gentlemen. I'm deeply honored and delighted to welcome each and every one of you this morning to the launch of the report of 2021 Multiple Indicator Cluster Survey and the National Immunization Coverage Survey, which we tagged 2021 Mix-NIX. I'm especially honored by the acceptance of His Excellency, the Vice President of the Federal Republic of Nigeria, Professor Yemi Osibajo, who is very ably represented here by our own Honorable Minister of Finance, Budget and National Planning, to launch this report. Thank you, ma'am. This gesture, in addition to the presence of honorable ministers of the Federal Executive Council and other top government functionaries, goes a long way to underscore the importance that this administration accords to the production and application of statistics in its developmental processes, and this is acknowledged and highly appreciated not only by MBS, but the entire Nigerian statistical system. This launch is the climax of months and years of hard work and determination in the planning, preparation, and execution of the survey by staff of the National Bureau of Statistics, with support from the great partner that we have in MBS, which is UNICEF, and other members of the National Steering Committee, as well as technical committees. So as you can imagine, we are all extremely delighted to be finally unveiling the results of this important survey to the general public. Being the 6th round of the survey in Nigeria, MIX is one of the largest sources of statistical sound and internationally comparable data on women and children worldwide. It focuses on issues such as health, education, child protection, water and sanitation, among others. The survey also serves as a major source of data for assessing the implementation of the Sustainable Development Goals, SDG, with over 20% of the indicators required for tracking the SDG being sourced from these big surveys. On the survey itself, this round is particularly interesting and fascinating. This is the first time that the survey will be conducted since the advent of COVID-19 in Nigeria. With the severe effect of the pandemic on the health status of citizens, the result of the survey will go a long way to shed more light on the impact on our citizens and the whole life of Nigerians. The first round of MIX was conducted by the then Federal Office of Statistics, which is now known as MBS, way back in 1995. Since then, there have been exciting and progressive changes to each successive round, with each round has come with new improvements and innovations, which have brought some of the excitement and enthusiasm for both the producers and users of this data. The improvements have been in diverse forms, be it in addition of new modules to the questionnaires, or new questions added in the modules, or even the new measurement that we have, as well as the technology that we adopted in conducting the survey. This is certainly one survey whose design and methodology has consistently kept us with the pace of change in society, and has always attempted to monitor and report on these changes and how they affect life of women and children in particular, as well as the general household in Nigeria. This round of the survey, which has over 200 indicators, recorded the highest response rate in the history of mixed series in Nigeria. They recorded impressive response of 99% rate. It also had some notable improvements that were added, making it the most comprehensive mixed survey ever to be conducted in Nigeria. These improvements were in the form of an addition of entirely new questionnaire to the survey, as well as the inclusion of new modules to the existing questionnaire that we have. A completely new questionnaire, which focuses on children aged 5 to 17, was introduced under this 6th round of the mix. This questionnaire deals with issues such as foundational learning, child functioning, and parental involvement. New modules were also added to existing questionnaires. New modules such as energy use, social transfer, and food security, which we all added to the household questionnaire. While new modules on victimization and financial inclusion were added to the questionnaire for women and men. Looking critically at the nature of these new additions, it is evident that these are topical issues and areas in which more information is required by government and policymakers to enable them monitor relevant policies, programs, and intervene where necessary. These are just some of the ways by which the mix exercise globally, and indeed in Nigeria, is consistently meeting critical data needs that concerns the well-being of women, children, and the general household as we have them. Finally, as I conclude my remarks, it is my hope that the launch of these results today and the subsequent deliberations that will follow both at the zonal and state levels will lead to the review, design, and implementation of policies and programs that positively impact on the life of Nigerians, more particularly on the life of women and children. So, on behalf of the hardworking and committed members of the 2021 Mixed NICS, as well as the National Steering Committee, I welcome everyone present here today and wish all of us a successful launch event that is planned. Thank you very much for your attention. God bless you all. God bless Nigeria. Thank you.
I think we can make the applause warmer. Yeah, that's warm enough. Thank you very much, and a big well done to the Statistician General of the Federation and CEO of the National Bureau of Statistics, Prince Adeyemi Adeniran. We appreciate you, sir, and indeed for highlighting the new indicators of social transfer, household energy use, child functioning, foundational learning skills, food security, and all that have been added to the mix, definitely expanding our scope to ensure that the Nigerian people have much more on their tables. Thank you once again. I'd like to recognize respectfully Dr. Bubakar Dieng, Senior Technical Assistant at Gavi, one of our supporters today. Thank you so much, sir, for being here. We appreciate you. And moving on right now, we go to the remarks of the UN Resident and Humanitarian Coordinator in Nigeria, Mr. Matthias Schmale, who is ably represented by our very own representative of UNICEF, Mr. Peter Hawkins. Please, a round of applause for him.
Thank you very much. Your Excellency, the Vice President of the Republic of Nigeria, Professor Yemi Osinbajo, very, very ably represented by the Minister of Finance, Budget and National Planning, Dr. Mrs. Zainab Ahmed, Minister of State for Budget and Planning, my very own brother, Prince Clem, representatives from the Ministries of Education, Women's Affairs and Health, the Statistician General, the ED for the MPHCDA, and ladies and gentlemen, may I rest and stand on existing protocols. Today, I'm speaking on behalf of Mateusz Schmull, the resident coordinator, and also the UNICEF representative, who happens to be myself. And I am very, very grateful to be present at the launch of this very important and timely report. I want to start off with my sincere congratulations to the National Bureau of Statistics, and especially to the Statistician General, Prince Yemi, for your leadership, both as the convener of MIX, but also as the Statistician General. A round of applause for... I would also like to thank and congratulate the enumerators. There were over 500 enumerators who went about their business with diligence and bravery. I want to thank the National Primary Healthcare Development Agency for their support, especially over the NICs, and especially to all the line ministries, the Ministry of Health, Ministry of Education, the Ministry of Water Resources, and all the other ministries who diligently supported the steering committee and contributed considerably to the development of this report and of the survey results. Their contribution and their ownership of this, of MIX 2021, is of critical importance. I want to congratulate the UNICEF team, Klaus, Hisham, Sylvester, all our team in New York, for their oversight and 24/7 commitment to the task ahead. To Bill and Melinda Gates Foundation, to Gavi, for their contribution, support, and the timely use of the NICS data. Ladies and gentlemen, Your Excellency, the Multi-Indicator Cluster Survey and the National Immunization Coverage Survey 2021 is born. The MIX and DICS data will help Nigeria to better assess the progress of its global and regional commitments, which seek to promote the welfare of women and children. It will benefit the government of Nigeria through its National Development Plan, the African Union and its 2063 Agenda, the United Nations 2030 Agenda and its attendant SDGs. It will help the governors to assess their own progress and use the data to inform decision-making. But most of all, it will benefit the Nigerian people and their own development aspirations. The United Nations aims to be more transformative and catalytic in nature, to help Nigeria move that needle to achieve far greater impact in its own developmental aspirations. Good information and data is vital in this pursuit. As the great former Secretary General and person of this region, Kofi Annan, once said, "Without good data, we're flying blind. If you can't see it, you cannot solve it." Data is the lifeblood of all our developmental efforts. Hence, the contents of this survey will help us not just to see challenges, but to help solve those problems. The report is particularly timely because it provides a fresh batch of data from 2021. This enables us to take into consideration the evolving national and regional context of Nigeria, in light of the worst impacts of the COVID-19 pandemic and the shifting global conditions. This data will be invaluable as we try to get back on track and accelerate our trajectory towards the achievements of the SDGs. In fact, the Multi-Indicator Cluster Survey 2021 results in over 40% of all household SDG indicators. It will highlight gaps in the provision of basic services for women and children, especially in the area of health, education, water and sanitation, and nutrition. The new insights contained within the report will inform and enable better decision-making across government, at federal and at state level. It is a learning progress for all stakeholders involved in the development of this nation as we examine what has been working and what has not been working. It will help recalibrate and refocus our efforts as we collectively strive to achieve the 2030 agenda. Granular data is especially important in a large and diverse nation of more than 200 million people, like Nigeria. Its 6 geopolitical zones each have their own particular needs and characteristics. Tailor-made approaches can now be formulated at the state and regional levels based on the context provided by this report. Disaggregated data of this nature also allows us to pinpoint the most vulnerable people in the most at-risk locations, such as women, girls, and those with disabilities. This information is essential if the United Nations is to live by its principle to leave no one behind. The first of the multi-indicator cluster survey was conducted here in Nigeria in 1995, and today we launched the 6th such survey. And the report is very interesting to read. Child mortality has decreased from 1 in 8 in 2016, dying before their 5th birthday, to 1 in 10 today. Very importantly, though, I want to bring out one area: immunization rates. They have gone up, Penta 3, from 34% in 2016 to 57% today. Only in the past 3 years, it went up from 50% to 57%. These are remarkable figures as they show an increased access and delivery of immunization services despite the COVID-19 pandemic. Congratulations to all involved. There's also been significant progress in exclusive breastfeeding, birth registration rates. Exclusive breastfeeding has increased from 24% to 34%, while 50% of Nigerian children under the age of 5 now have their births registered with civil authorities. That is compared to 47% in 2016. In addition, child marriage, i.e. women under the age of 18, has dropped from 44% down to 30% since 2016. However, regional disparities still exist, and this is probably the most important part of the multi-indicator cluster survey's outcome, that we need to be looking at the disparities as well as the absolutes. Under 5 birth registration is almost 4 times higher in a state like Lagos than it is in Sokoto. In addition, while exclusive breastfeeding is on the increase, breastfeeding within the first 1 hour of birth has dropped by 10 percentage points. That is likely due to the fact that the percentage of skilled birth attendants has remained static at 50%. Child marriage is about 4 times higher in rural areas than in urban areas. And immunization rates in some states are only reaching less than 1 in 4 children. In closing, I want to reiterate my congratulations to the government of Nigeria through the National Bureau of Statistics, the Ministry of Finance, Budget and Planning, and to all the stakeholders, the Ministry of Health, Education, Water and Resources, Women's Affairs, and all the others, in the successful undertaking of the Multi-Indicator Cluster Survey 2021. This is a landmark report which the whole nation will benefit from, but to do so, we must all commit to use it both in absolute terms at national level, but in disaggregated terms at state level. Thank you very much.
Thank you very much, Mr. Peters. For those of us who watched AIT yesterday and saw Mr. Peters, I think he deserved another round of applause. Thank you very much. Please, someone left his bunch of keys at the point of registration. Before it goes far, if you are the one, please go for it. And an ID card also belonging to one Idris Jibrin from University of Abuja. Please collect them at the registration point. Your Excellency, distinguished ladies and gentlemen, what we have just had being rolled out is as a result of a collaborative effort of committed member and sisters organization. One of such, as we take the goodwill messages, has differently at different points act like a senior brother, a financier, a supporter of the National Bureau of Statistics. Tall in goals and ambition, even physically, beautiful in their hearts with very handsome achievement. Let me welcome, distinguished ladies and gentlemen, the Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Faisal Shab, for his goodwill message. Please, let's put our hands together for him.
Your Excellency, the Vice President of the Federal Republic of Nigeria, ably represented here by the very impressive Honorable Minister of Finance, Budget and National Planning, the Minister of State for Budget and National Planning, the Honorable Minister of Health, ably represented here by the Permanent Secretary of the Federal Ministry of Health. Distinguished ladies and gentlemen, permit me to rest on already well-established protocol. For us at the National Primary Healthcare Development Agency, data powers everything. And it is very important that today we bring to all Nigerians the data from the last couple of years. We've worked very intimately with the Director General of the National Bureau of Statistics. Even at the height of the pandemic, we toiled night and day to make sure that every barrier was overcome to make sure that this data is presented to Nigerians, because it is this data that tells us how well we're doing. It is this data that forms a benchmark between our vision and what we're able to produce. In the last couple of years, we've seen how working with frontline health workers, we've been able to bump immunization rates from 33% to 57%. All of this happens because of the intricate plans that have been made at the federal level, working with stakeholders, our development partners, community-based organizations, faith-based organizations. But all of this wouldn't have been possible without the leadership provided by President Muhammadu Buhari. I want to particularly appreciate the Honorable Minister of Finance, who has never balked any time we go to her office to make presentations around how important it is to provide resources for primary health care. Immunization is very, very key. This is why, apart from the multi-cluster survey that we do, we made a particular provision for immunization data because immunization is the entry point to all primary healthcare services. I want to really appreciate the professionalism of the National Bureau of Statistics. Very few agencies in Nigeria really take their work as seriously as they do. My brother, the DG, has been exceptional. As director, he paved the way for so many things in terms of making and helping partners such as the National Primary Healthcare Development Agency understand the complexities of the immunization coverage survey. We've compared this across board with what happens globally. Only a few days ago, we received information that from a global perspective, Nigeria is one of the few countries where the global pandemic had very little impact on immunization coverage. That means that despite all of the barriers to accessing primary healthcare services, Nigerians still were able to take their kids for vaccinations, and health workers were there to give them these services. These health workers are the most important part of the primary healthcare space. We have tall dreams for primary healthcare. But unless and until we address the issue of inadequate human resources at primary healthcare, we'll keep moving around in circles. 57% is a great leap from 33%, but Nigeria can do better. But for us to do better, we have to work with the subnational level to address challenges such as only 27% of our primary healthcare centers countrywide have the right complement of human resources. We cannot jump to 80% or 90% until we address this. So I'm happy that the Nigeria Governors Forum is here. I'm here that the media is here. I'm happy that the Minister of Finance is here so that we can continue to engage with our governors, engage with our local government chairmen to address the issue of human resources, suboptimal human resources at the primary healthcare level. I thank you very much for this opportunity.
Thank you so much, Dr. Faisal Shuaib of the NPHCDA. Indeed, having the human resources to carry on is so important, and it's good we have everyone in the room who should do something about it to ensure we are all taken care of as Nigerians at all levels. Because the point of the SDGs is leave no one behind. So taking everybody along would make a big difference. The next to give a goodwill message is the representative of the WHO, Dr. Claudia Vivas is UHCLC cluster lead, and she represents the WHO representative in Nigeria, Dr. Walter Kazadi Mulumbo. Please let's give her a round of applause.
Protocol observed, and on behalf of Dr. Walter Kasidi Mulombo, the head of mission and representative of the World Health Organization in Nigeria, I want to start by acknowledging Your Excellency, the Vice President of the Federal Government of Nigeria, for the great strides that Nigeria has made to improve immunization coverage. It is my singular honor for WHO to join Nigeria in the launch of the MIG-6 NICS-21 survey report for Nigeria. The multi-indicator cluster survey and the immunization coverage survey are important surveys that provide valuable data on immunization, child survival, development, protection, rights of the children, women, and men. The launch of this report presents a good opportunity for Nigeria to track progress towards achieving country health targets. The comparability of the results of both surveys across countries underpins the value of surveys to aid country-led progress review towards achieving health SDGs. Inequity among and within countries remains a barrier that needs to be addressed to achieving universal health coverage, and the surveys provide insights to this. In 2020, just 10 countries account for 62 of unprotected children with immunizations worldwide. As we strive to achieve UAC and the health-related SDGs, the mix provides relevant information for monitoring country progress and will guide Nigeria's approach to primary health care, strengthening, remanaging new PHC. The mix presents the opportunity for reprioritizing, repositioning, strategy readjustments, and realignment of resources towards the achievement of the UAC goals of leaving no one behind. WHO commends the Nigeria government for the unique success in integrating and conduct of these two important surveys, the mix and the NICS. We recognize the applications of lessons learned from the initial integration of the surveys to optimize time, human, and financial resources, and the addition to knowledge and experience for health surveys. We commend the government in declaration of an emergency of routine immunization following the poor NICS results that we got in 2016-2017, with a penta-3 coverage of 33%. The efforts has led to increase the routine immunization coverage in Nigeria in 2021, despite the effects of the COVID-19 pandemic, and contrary to the observation of lower coverage rates in many other countries. WHO commends the federal government of Nigeria for maintaining the broad partnership for health through the Federal Ministry of Health, and WHO remains committed to continue to provide support and work with the Federal Ministry of Health through the different ministries, the MPHCDA, and other relevant ministers, departments, and agencies to achieve the country's health goals. Thank you very much.
Thank you very much, Dr. Vivas. Please let's appreciate her once again. As we continue our goodwill messages, I have come to an obvious conclusion that most directors of ICT hardly tell lies, they go straight. We normally sample in NBS, so I always use my director of ICT as an example. Having dealt with figures, he will always tell you straight. No wonder the Honorable Minister of Education, Adamu, decided to send the Director of ICT. Distinguished ladies and gentlemen, let's welcome the Director of ICT of the Federal Ministry of Education, Abubakar Issa, for the goodwill message on behalf of the Honorable Minister.
Thank you for your kind words. Your Excellency, the Vice President, Professor Yemi Osinbajo, ably represented by the Honorable Minister of Finance, Budget and National Planning, the Honorable Minister of State for Finance, distinguished ladies and gentlemen, this is the goodwill message from Malam Adamu, Minister of Education. I am delighted to welcome you all to the launching of the 2021 Multiple Indicator Cluster Survey and the National Immunization Coverage Survey Report. I'm also pleased to appreciate the effort of the National Bureau of Statistics and the National Primary Healthcare Agency in conducting the immunization survey. As you are all aware, education is vital for attaining the Sustainable Development Goals and the improvement of the capacity of our children to survive and contribute meaningfully to the society. The health and well-being of our children are therefore critical. I'm therefore highly optimistic that the recently conducted household survey will improve our maternal health and the well-being of our children. The Ministry appreciates the collaborative effort between National Bureau of Statistics and the Federal Ministry of Education. Finally, I appreciate the United Nations Children's Fund, Gavi, for their support and contribution. I also encourage all stakeholders in education to partner with us towards attaining the Sustainable Development Goal. I wish you a very memorable event, and thank you.
Thank you, sir. Our sincere apology. We never imagined this height. So the microphone is... As we continue with the goodwill messages, Your Excellency, distinguished ladies and gentlemen, permit me to respectfully invite the Permanent Secretary, Federal Ministry of Health, Mr. Mahmouda Maman, who will also give his own goodwill message. The Permanent Secretary. Please, an applause for him.
The representative of the Vice President of the Federal Republic of Nigeria, Honorable Minister of Finance, Budget and National Planning, Hadia Dr. Zainab Shamsina Ahmed, the Honorable Minister of State Budget and National Planning, Prince Clem Eba Agba, the representative of the Honorable Minister of Education, the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib, the Statistician General of the Federation, the Director General of the Nigeria Governors Forum, the country representative of UNICEF, and also the representative of the United Nations Humanitarian Coordinator, other representative of development partners, distinguished ladies and gentlemen of the press. My Honorable Minister is unavoidably absent because he is currently involved in the launching of the End Malaria Council currently taking place together with Mr. President. So he asked me to represent him and read his speech. Thank you. I wish to thank His Excellency, the Vice President of the Federal Republic of Nigeria, ably represented by the Honorable Minister of Finance, Budget and National Planning, for the outstanding support to the Federal Ministry of Health and its agencies and parastatals towards improving the health of Nigerians and achieving Nigeria's health indices. I also want to particularly appreciate the acceptance of the Vice President to personally launch the 2021 Multi-Indicator Cluster Survey and the National Immunization Cluster Survey 2021 Mix and Nix report today. I recognize and thank the Honorable Minister's President, the Executive Director, National Primary Healthcare Development Agency, the Statistician General of the Federation, and other heads of agencies here, including the heads of UN agencies, directors from ministries, department, and extra-ministerial department, and our esteemed partners. I commend the commitment of the National Bureau of Statistics and our partners who commenced the 2021 Mix and Nix during the COVID-19 lockdown and restrictions and worked tirelessly to ensure its completion of the report that we are going to launch today. Distinguished participants, 5 years ago, when the Mix and Nix 2016 survey was launched, result was launched, much concern was raised about the performance of our health sector, especially the issue of routine immunization, where the pentatory coverage was 35%. Though we are not yet where we want to be, we did make considerable progress by attaining 56% pentatory coverage, especially when taken against the backdrop of recent global challenges affecting the health sector. Health intervention have become more data-driven now, and Nigeria is striving to meet up with global best practices because plans made with unreliable data will deliver uncertainty. The Mix and Nix gives a global standard of data reliability for evidence-based decision-making processes. Distinguished participants, the Mix and Nix survey is strategic to our health sector since it is used as the basis for prioritization of most interventions, including the current multi-year country plan endorsed by the federal government and Gavi partnership, the Nigerian strategy for immunization and primary healthcare system strengthening and prioritization of low-performing states. The clear priorities, goals, strategic objectives, and result in the National Strategic Health Sector Development Plan necessitate a new paradigm shift from the normal ways of business as usual to an accountable and transparent form with a focus on evidence-based planning. This requires collaboration deeply rooted in the mix and NICS we are about to launch today. The mix and NICS platform provides opportunities for healthcare services, gaps, and plan executions of innovative strategies, up to routine monitoring progress and conducting secondary analysis on the status of the 774 local government areas that will be prioritized for further supports. Today, we are gathered for two celebrations. One, launch of the results survey that the world will use to assess our performance in the next few years. And two, celebration of the successful and effective collaboration among many stakeholders within and outside the health sector. This gathering today is made possible with support of related ministries, departments, and ministerial agencies, national and international partners, academia, and others. I wish to specifically appreciate the support and commitment made by UNICEF in ensuring the success of this survey. Nigeria is indeed appreciative of the support you have given and for the enabling environment to provide of higher quality healthcare services. I must also appreciate the civil servants who have been part of these processes directly or indirectly. You have made us proud, and our country is indeed indebted to you all. Finally, distinguished ladies and gentlemen, as we formally launch the Mix and NICS 2021 result, it is time for us to begin to use the Mix and NICS 2021 results for action. I urge all stakeholders in the health sector and beyond to double their efforts to ensure successful integration of intervention. I wish you success and God bless you all. Long live the Federal Republic of Nigeria, and thank you for listening.
Thank you so much, Mr. Mahmouda Maman, the Permanent Secretary of the Ministry of Health and the representative of the Minister of Health. Please let's give him another warm round of applause. We appreciate you, sir. Moving on now, I'd like to invite for his goodwill message the Senior Technical Advisor to the Senior Special Assistant to the President on SDGs, Dr. Bala Yunusa. He has a brief word for all of us. Please, let's give him a round of applause as he makes his way here. Thank you so much.
Thank you. The Honorable Minister of Finance, Budget and National Planning, the Honorable Minister of State, Budget and National Planning, distinguished participants, please permit me to respectfully stand on the well-established protocol as I bring warm greetings from Her Excellency Princess Adejoke Orolobe Adeflure, the Senior Special Assistant to the President on Sustainable Development Goals, who is unavoidably absent because she is on transit at the moment and has kindly asked me to represent her here. Distinguished participants, when the world leaders adopted the 2030 Agenda for Sustainable Development, they were clear that they envision a present and a future that is economically sustainable, socially inclusive, and environmentally resilient. And that vision is expressed through the framing of the 17 Sustainable Development Goals, 169 targets, and 230 key performance indicators. Broadly, the SDGs are a universal call to action to end extreme poverty, safeguard the planet, and ensure all people enjoy peace and prosperity by the year 2030. And when the world saw the implementation of the Millennium Development Goals, one key finding, especially in Nigeria, was that the Millennium Development Goals lacked baseline data. And so since 2016, our office worked closely with the National Bureau of Statistics to completely realign the national statistical system with the requirements and indicators of the SDGs, so that on annual basis, we will be able to track progress through the National Statistical System for the SDGs. And incidentally, 70% of the 230 key performance indicators will be coming from the periodic system of administrative statistics of the ministries, departments, and agencies. And about 25% will be coming from the periodic surveys, the Nigeria Living Standard Survey and the multi-indicator cluster survey. And so this is a major milestone in our efforts to operationalize the SDGs. I congratulate the National Bureau of Statistics and all stakeholders for this milestone. I thank you all for your attention.
Thank you, Dr. Bala. You will see in the program that the SDG was not there, but we quickly remembered their logo of Leave No One Behind. And if they are the architect of that and we left them behind, then we are already doing. Thank you very much. Your Excellencies, distinguished ladies and gentlemen, so much have been said about the NBS. I want to place it on record that all this is not by accident. We at the National Bureau of Statistics have had it so good that in all these years, the two honorable ministers just before us have taken pleasure personally, have it on record, that no other ministers have ever visited the National Bureau of Statistics the way the two ministers did. Please, may we give them a round of applause. I dare say the successes we had in NBS, whether by coincidence or whatever, and I don't think history will repeat that, having an honorable minister oversighting the NBS as a prince, and then having the Statistician General also as a prince. Distinguished ladies and gentlemen, as we move forward to take the special remarks to be done by the prince himself, the Honorable Minister of State, Budget and National Planning, Prince Clem Nkanade Agwa. Please, let's welcome the Honorable Minister. Please, let's encourage him. I love those intelligent steps.
Your Excellency, the Vice President of the Federal Republic of Nigeria, here ably represented by my friend and sister, the Honorable Minister of Finance, Budget and National Planning, Mrs. Dr. She says it's not Dr. Mrs., it's Mrs. Dr. Zainab Ahmed. Representatives of the ministers that are here present, the Statistician General of the Federation, my brother Prince, the Chairman of the Board of NBS, Dr. Nakaro, the ED National Primary Health Care Development Agency, Dr. Pfizer, the UN Resident Coordinator here ably represented by Peter, heads of government agencies, our development partners, distinguished ladies and gentlemen. I don't know what makes my speech different, that it should be called special remarks. But if I am to give special remarks, it means that Her Excellency, the Vice President, is going to be giving very special remarks. It is my pleasure to be here at this auspicious occasion of the launch of the 2021 Multiple Indicator Cluster Survey and National Immunization Coverage Survey Report. Today's event marks yet another milestone in the annals of our history on the collective efforts towards achieving the Sustainable Development Goals in Nigeria by the year 2030. Let me at the outset state that the 2021 Multiple Indicator Cluster Survey and the National Immunization Coverage Survey has its main focus on the household, major attention on social development and household information, including the well-being as well as inclusive growth of women and children. This therefore presupposes that the survey was not only designed to collect data on protection, early childhood education, health and nutrition of the child, among other indicators, but will also serve as an essential ingredient for measuring and assessing progress on national and global goals, such as the African Union Agenda 2063 and the United Nations Sustainable Development Goals. It is pertinent to state that reliable socioeconomic data is vital to achieving Nigeria's current development priorities, with emphasis on the development aspiration of His Excellency President Muhammadu Buhari's administration. Thus, the Multiple Indicator Cluster Survey and the National Immunization Coverage Survey has become a key source of data on child protection, early childhood education, as well as source of information on child health and nutrition. The National Bureau of Statistics, as the custodian of the national statistical system, have by this report provided a scorecard that shows us where we are in achieving our part towards achieving the 17 SDGs. As we are treading the decade of action for achieving sustainable goals by 2030, we all have a responsibility to ensure that all hands are on deck to making achieving Agenda 2030 a reality in Nigeria. Suffices to state that we cannot underestimate the critical role played by quality data in economic planning, management, and policy decision-making. This is because reliable statistics are essential for proper measuring, monitoring, and managing the outcomes of development interventions. It is noteworthy that statistical evidence have been the foundation for all fiscal planning, including annual budget for equitable allocation of resources. That is why the government will continue to provide necessary support to the national statistical system to ensure the production of reliable data for tracking developmental progress. Your Excellency, the Vice President here ably represented, honorable ministers here represented, heads of development partners, distinguished ladies and gentlemen, I wish to apprise you that Nigeria has been able to generate much needed data that captures a significant proportion of household-based indicators as it affects the welfare and development of women and children across the country through the Multiple Indicator Cluster Survey Report. The information from the survey report has over the years been key sources of data to both the development and implementation of the National Development Plan, with health and all other sectors in focus. There's no gainsaying the fact that the 2016-2017 Multiple Indicator Cluster Survey Report has served as a useful guide in policy decisions making, including the development of the erstwhile Economic Recovery and Growth Plan 2017 to 2020 and the National Social Protection Programs, all of which address the plight of the disadvantaged and vulnerable households across the country. At this junction, let me congratulate the National Bureau of Statistics, led by the Statistician General of the Federation, Prince Adeyemi Adeniran. Only a while ago, I was saying to my sister, the Honorable Minister of Finance, Budget, and National Planning, that yesterday I paid an unscheduled visit to the Bureau, and this was about 6 p.m. And they were still very much at work. The atmosphere is a lot better than I had seen it in the last 3 years. And I also see that the morale of the staff has improved greatly. So, Statistician General, to whom much is given, much is expected. You are doing well, but we need more improvement. I also like to congratulate UNICEF and all other key stakeholders that were directly or otherwise involved in the process that led to the production of this important statistical report. It is my belief that this report will not only serve as a resource for tracking the implementation of the 2030 agenda, but will also complement other key demographic, health, and socioeconomic surveys. In concluding, I wish to thank my dear sister and friend, the Honorable Minister of Finance, Budget and National Planning, Mrs. Dr. Zainab Shamshuna Ahmed, for our partnership and our consistent dedication to the Nigerian project by sparing time to be part of today's epoch-making event, despite her tight schedule. And I pray that God will continuously strengthen her to carry through the arduous task of governance. I also appreciate my colleague, honorable ministers, permanent secretaries, heads of development partners, as well as other distinguished guests for honoring our invitation. Thank you very much for your attention. God bless you. God bless the Federal Republic of Nigeria.
For those special remarks, I think he deserves a special round of applause. When the very special remarks come, I'm sure we'll do a very special round of applause. All right, so thank you so much, the Honorable Minister of State, Budget and National Planning. We appreciate you. We're moving on to take a look at the overview and have a synopsis of the 2021 Mix and NICS report. It's a video that we'll play right now.
We are children of Nigeria. We live in busy cities, rural areas, IDP camps. We need nutritious foods, safe water, clean toilets, education, health care, protection, and more. Some of us are doing better than others. How can you know where we are and how to reach us?
Through data, data make the invisible visible by revealing gaps and disparities. And behind each statistic is the story of a child. MIX, Multiple Indicator Cluster Survey, is a global household survey program that generates data on the lives of children and women. For the 2021 Mix Nigeria, interviewers traverse urban and rural areas to interview more than 39,000 households.
Multiple Indicator Cluster Survey and the National Immunization Coverage Survey 2021 in Nigeria has a lot of data that government can use for evidence-based policy making, for program monitoring and evaluation. We have quite a lot of data relating to women. For the children, we have quite a number of data that government can also use to plan for our children. As we know, the children is the future of the country.
What do the survey tell us? That the lives of children are improving. 57% of children aged 12 to 23 months old have received all 3 doses of the pentavalent vaccine, compared to 34% in 2016. 6 out of 10 children have their births registered. This is up from 5 in 10 compared to 5 years ago. 3 out of 10 infants under 6 months of age are exclusively breastfed. This is an increase of 10 percentage points since 5 years ago. But we are also not doing enough. 9 out of 10 children are subject to violent discipline. 1 out of 4 children of primary school age are out of school.
The long-awaited MixNix 2021 has been released. MixNix is unique because it meets the highest global standard in terms of the concept, the methodology, partners alignment, usability, and dissemination.
As a policy tool, the Multi-Indicator Cluster Survey 2021 is a very important indicator to help us monitor against the SDGs, monitor against multidimensional poverty index, and other such surveys to make decision makers be able to focus their resources in areas that have the most impact on women and children.
The children of Nigeria, the hope for tomorrow.
Thank you very much. Today is marking history yet again in Nigeria, and particularly at the National Bureau of Statistics. I wish I know how to exaggerate. I would have exaggerated the name of the Honorable Minister of Finance. Unfortunately, the last time I did so, she said I was on my own, so I don't want to be on my own. I want always to be covered by her. But surprisingly, when she reminded me a week ago about this function, I was wondering why it was so. Then I discovered that, first of all, passing through Queen Amina, they were taught motherhood. And then she became a mother and a Minister of Finance, abandoning her schedule sometimes to come to National Bureau of Statistics, ensuring that data is not only made available, but timely and credible. Distinguished ladies and gentlemen, having had that passion for women and children and the country at large, we are missing nothing when she's actually standing in for the Vice President. Distinguished ladies and gentlemen, permit me, in a most respectful manner, welcome the Honorable Minister of Finance, representing the Vice President of the Federal Republic of Nigeria, Dr. Mrs. Zena Sansida Ahmed. Please give her an encouraging applause. Thank you very much.
Thank you very much. Good morning, Excellencies, ladies and gentlemen. Let me start by, first of all, extending the greetings as well as apologies of His Excellency, the Vice President of the Federal Republic of Nigeria, Professor Yemi Osinbajo, SAN, who is unavoidably absent today. And also follow up quickly by recognizing my colleague and brother, Prince Clem Agba, the Honorable Minister of State, Budget and National Planning, the Permanent Secretary, Ministry of Health, representatives of the Honorable Ministers of Education and Women Affairs, the Solicitor General of the Federation, the Chairman and members of the Board of the NBS, the Executive Secretary, the National Primary Healthcare Development Agency, Dr. Faisal, all heads of agencies and representatives of ministries, departments, and agencies, representatives of the Nigerian Governors Forum, the UN Resident Coordinator, represented today by the UNICEF country rep, Mr. Peter Hawkins, representatives of Gavi, the Vaccine Alliance, representative of the Bill and Melinda Gates Foundation, representative of the World Health Organization, all development partners that are here today, health sector practitioners, academia, excellencies, members of the diplomatic corps, members of the press, distinguished guests, ladies and gentlemen. I am here to deliver a speech on behalf of His Excellency the Vice President, so for the records, I will be reading the speech, and if I deliver it well, it's for the Vice President. If I make a mistake, the mistake will be mine. It is my pleasure to be here at this epoch-making event to launch the Multiple Indicator Cluster Survey Mix and the National Immunization Coverage Survey NICS 2021 report carried out by the National Bureau of Statistics with support from the United Nations Children's Fund UNICEF, Global Alliance for Vaccine and Immunization Gavi, and the Bill and Melinda Gates Foundation. The mix has been addressing data challenges in Nigeria for more than 20 years, expanding from 28 cluster indicators in the first publication to over 200 indicators in the current report that we'll be launching today. Representatives of honorable ministers, heads of development partners, distinguished ladies and gentlemen, I wish to state that the Multiple Indicators Survey, as well as the National Immunization Coverage Survey, is a comprehensive household survey designed to provide up-to-date data for assessing the situation of women and children in Nigeria, as well as tracking socio-economic activities as it affects the entire population. The report of the survey serves as a key source of data on child protection, early children education, and overall provides reliable data for evidence-based policies and programs. As a tool for monitoring progress towards national goals as well as global development agenda, including the Sustainable Development Goals, the SDGs, the report focuses on child health and nutrition, which is in tandem with the National Nutrition Policy and Multi-Sectoral Plan of Action for Food and Nutrition in Nigeria. The data users and researchers working on social economic development areas will find the data in this report useful because the Mix 6 and the NIC report are central to the needs of all relevant survey stakeholders in the development space. Suffice it to say that over the years, the Mix and NICS surveys had focused on pressing social issues bordering on health, education, child protection, water and sanitation, and various topics that directly affect the lives of children and women. Therefore, these two reports will continue to serve as a major source of data in establishing the baseline for measuring progress on the 2030 Sustainable Development Agenda, focusing on key relevant indicators across several sectors. It is significant also to note that since the conduct of the last multiple indicator survey and the National Immunization Coverage Survey in 2016 and 2017, which is a 5-year survey, concerted efforts have been made by the current administration of President Muhammadu Buhari to address the data gaps reported in the 2016-2017 report, which has led to massive investments in healthcare sector with particular emphasis on primary healthcare delivery and immunization coverage. The education sector also is not left behind. Unfortunately, the outbreak of the deadly coronavirus and its different variants in 2020 led to some slowdown of social economic activities across the globe, including in Nigeria. However, the government of Nigeria continued contained the impact of the negative impact of the pandemic by proactively putting in place necessary measures to address the severity of the COVID-19 pandemic. The government will continue to provide necessary support to all sectors, particularly the maternal health care, so as to mitigate the incidences of maternal mortality and safe delivery of our women and better life for both the living and unborn children that are the future of our great country, Nigeria. Honorable ministers, heads of development partners, distinguished ladies and gentlemen, it is instructive to state that improving the survival rates among children depend on their access to routine immunization. Despite the tenacity of the primary healthcare workers, conducting routine immunization across the country, we still have low immunization coverage, with the largest proportion emanating from the northern part of our country. There has been conspicuous improvement in the coverage from 34% in 2016 to 57% as reported in the current round of the MICNICS survey of 2021. The target is to ensure that every child benefit from life-saving vaccines across the 774 local governments in the 36 states and FCT. The outcome of this report will enable government to re-strategize and scale up vaccination efforts to ensure total coverage of the entire population in need. I want to assure you that the government of Nigeria will continue to strengthen all sectors of the economy to ensure a balanced development both at the national as well as at the subnational level of governments. As a corollary to this, the government of Nigeria in 2020 mitigated the effect of the COVID-19 pandemic by developing the Nigeria Economic Sustainability Plan, which the Federal Executive Council approved in June 2020. The plan earmarked 10.3 billion for the health sector to fast-track the implementation of the National Water Supply, Sanitation and Hygiene Program, the WASH. Similarly, a sum of 199 billion naira was earmarked to develop a robust healthcare system to withstand future shocks. Other economic stimuli package measures introduced included the additional 100 billion naira intervention fund as healthcare loans to key pharmaceutical companies and healthcare practitioners intending to expand or upgrade their capacities. In furtherance of our efforts as government, we have identified key local pharmaceutical companies that will be granted funding facilities to support the procurement of raw materials and equipment required to boost local drug production conditions for the pharmaceutical companies, hospitals, as well as healthcare practitioners. All these interventions in the sector were necessary to revamp the healthcare sector and to put it right and put it on the right pedestal to tackle related challenges at the grassroots level. It is pertinent to place on record government's concerted efforts towards improving the lives of ordinary citizens through the social protection programs and as well as the strengthening of these programs. In this connection, the National Social Register as well as the state social registers have been expanded, with over 3 million Nigerians benefiting since 2020 from 20,000 naira transfers to the poor and vulnerable households registered in the National Social Register. This is in addition to microcredits made accessible to small business owners, including the coverage under the trader money as well as the market money. As we launch this report today, the quest to achieve our development goals and objectives is still the priority of government. The available data in the Multiple Indicator Cluster Survey and the National Immunization Coverage Survey report will enable government, private sector, and all relevant stakeholders to hit the ground running, particularly towards improving access to immunization for all our children as and when due, and also for the expansion of the immunization coverage to ensure every child has a better future. Government will continue to ensure the provision of primary health care to all Nigerians to enable our country achieve her development goals and meet up with the 2030 agenda. Excellencies, ladies and gentlemen, let me at this point commend the supervisory role of the Ministers of Finance, Budget and National Planning, as well as the Supervisory Board of the Nigerian National Bureau of Statistics and the management of the NBS for the production of this robust policy planning report that is relevant to effective implementation of the National Development Plan for 2021 to 2025. By extension, I wish to also again congratulate the newly appointed Solicitor General of the Federation, and the entire staff of the Bureau of Statistics, National Bureau of Statistics, and the Executive Director of the National Primary Healthcare Development Agency for their undeterred efforts and resilience in the production of the report being launched today, despite the challenges posed by the COVID-19 pandemic during the conduct of the survey. I also want to seize this opportunity to recognize the support of the UNICEF and the other development partners, including Gavi, the Vaccine Alliance, as well as the Bill and Melinda Gates Foundation, for their technical and financial support towards these reports being launched today and making Nigeria's launch a reality. It is therefore my singular honor and privilege to launch the Multiple Indicator Cluster Survey and the National Immunization Coverage Survey reports for the benefit of the Nigerian children and women in particular, and for the entire Nigerians at large. I want to thank you all for your kind attention, and God bless you all. God bless the Federal Republic of Nigeria.
Thank you. May I respectfully invite the Honorable Minister of State and all members of the first front row, please join the Honorable Minister in unveiling the report, please.
On behalf On behalf of His Excellency, the Vice President of the Federal Republic of Nigeria, it is my honor and privilege to launch the Multiple Indicator Cluster Survey as well as a Nigeria Immunization Coverage Survey to the glory of God.
Thank you very much.
I think the minister should have her copy right now. Thank you so much. That's the copy of the survey.
Maybe if we get the copies, you move towards the center.
Yes.
Towards the center, so that you can clearly. The Honorable Minister, please. Please let all members have copies and join the minister. After, okay, only two, okay. After this photograph, the Honorable Minister of Finance and that of Budget will remain. All directorate staff of the National Bureau of Statistics will have a photograph. After them, all UNICEF, Gavi, and Melinda, please, Melinda Gates will also have a photograph with the minister, please.
Cameras, are we done? Are we good? All right. So just a few more seconds.
And we don't know who will be good or not. So after the count of three, if you are not good, then you stop there. 1, 2, 3. Thank you very much.
Thank you.
Please, others can, the Honorable Minister of Finance and that of State, please, you can remain. Please, all members, quickly, Directorate of the National Bureau of Statistics, please. After that one, we'll have our development partners. Sorry.
Wow. It's a large crowd coming up. All right. Thank you.
That is the teamwork. That is why we produce very credible data.
Indeed.
So many good heads coming together.
Absolutely. And this is where we see partnerships working to ensure that data is produced for development. All right, cameras. Are we all set? All right, so.
Thank you very much.
Thank you. Cameras?
Are we good?
We're still setting up. No, we're not. Thank you. So I know the MBS team to be smiling people. So let's smile a bit for the pictures.
This
Thank
may
you.
be our only opportunity to start with the minister. Please smile.
All right.
Thank
so
you very much. UNICEF,
Thank
Melinda
you.
and
You
Jade
can go down
Garvey,
through the
please.
sides, please. Through the sides. Can we have UNICEF? Can we have Gavi? Can we have Bill and Melinda Gates Foundation?
Okay, the last one will be the State Surgeon Generals and Director of Statistics after this one.
I see
From
Gavi.
the
going
sub-national
up.
level. No, after UNICEF, please, before the State Surgeon General, please.
UNICEF, Gavi, Bill and Melinda Gates Foundation. Please let's join in. Thank you. And of course, MPHCDA. WHO, please. WHO, please join this picture. Thank you, ma'am. Please hold on, cameras.
Of course, she's the only wall here.
Thank you.
Cameras, are we good? Thank you very much. State Surgeon Generals, please.
So the program is not over. Please, can we just settle down so we can end properly after the pictures? Thank you. Please, let's all just settle down. Thank you.
SG is here. Gida Gombe, I have not seen him. Okay. Okay. And the last pictures will be the moderators, the MCs.
Yes, please. Thank you so much. Please, let's all settle down so we can end this completely. What's that? What's that? What did we forget? What did we miss?
We can come down, right? Yes.
Thank you so much. The representative of the Vice President of the Federal Republic of Nigeria, Professor Yemi Oshibajo, the Honorable Minister of Finance, Budget and National Planning, Mrs. Dr. Zainab Shamsuna Ahmed, thank you for that keynote address, and indeed for enabling the launch, the official launch of the 2021 Mix and Nix. Please would like to respectfully ask that we be seated so we can properly end this event. Let's just settle down. Thank you so much for that. Now to give the closing remarks, would like to invite the chairman of the governing board of the National Bureau of Statistics, Alhaji Kabir Nakaura. He will be giving the closing remarks at this point, sir. Please, let's give him a round of applause as he makes his way here.
Yeah, thank you very much. When you go through the book, my name is not there. So I think I come here accidentally. And by accident, I was asked to read the closing remarks. So here it goes. It is supposed to be read by the Honorable Minister, Budget and National Planning. But I was asked to do it. So as my Honorable Minister said, when she was reading that of Vice President, she said, any good thing is for Vice President and any mistake is for her. But me, I say, any mistake is for me, not to him. So let me just read this on because we are here by accident, so accidentally I'm going to read the report. Thank you very much. I am delighted to give these closing remarks following the launch of 21 multiple indicator closer survey, national immunization coverage report, which is a 5-year survey with the last one in 2027. Your Excellency, the Vice President of the Federal Government of Nigeria, ably represented by the Honorable Minister, Finance, Budget, and National Planning, and all other protocol engaged. Distinguished ladies and gentlemen, let me reiterate that the 21 multiple indicator closer survey, national immunization coverage survey report has been just launched. Will provide data for tracking both social and economic activities relating to women, children, and Nigerians at large, at both the national and sub-national level, and ultimately have as reference material for policy formulation and decision making. It is therefore imperative that I enjoy all the stakeholders to take advantage of the 21 multiple indicator closer survey and the National Immunization Coverage Survey report, which should by no means be an end in itself, as we must continuously promote the generation and use of data and statistics for the evidence-based design, implementation, as well as evaluation of projects and programs as enshrined in the National Development Plan 2021 to 2025. Let me add that the launch survey report will immediately be disseminated across the 6 geopolitical zones for wider coverage and utilization by all and sundry. In concluding the remarks, I wish to seize the opportunity as a supervising minister of the National Bureau of Statistics and on behalf of the Federal Ministry of Finance, Budget, and National Planning, thank His Excellency, the Vice President, Professor Yemi Osibanjo, for finding time to grace this occasion and for which serve as an inspiration for improved efficiency and effectiveness toward production of future survey. I also wish to appreciate my dear sister, the Honorable Minister of Finance, Budget, and National Planning, Mrs. Dr. Zainab Shamsun Ahmed, for her presence and the perennial support to the Bureau in actualizing its mandate. My deep appreciation is extended to other honorable ministers and the permanent secretaries present here today, including the heads of development partners as well as other distinguished guests and honor our invitation. I would like to congratulate the Statistician General of the Federation and the Chief Executive Officer of National Bureau of Statistics and the entire staff of the Bureau for working tirelessly and consciously in ensuring that today's event comes to the fruition. I wish to congratulate the Executive Director of the National Primary Health Care Development Agency, Dr. Faisal Shah, for the success of this round of survey for assessment and organization. I also wish to thank all for kind attention and wish us divine protection as well as departure for our respective destination. God bless us. God bless Nigeria. Thank you very much for listening.
A big thank you to the chairman of the governing board of the National Bureau of Statistics. Thank you so much. Well, we have come to the end of this, and just to announce a few things. First is that we'll have refreshments served to the right of this hall. That will be to your left of the hall. We'll have some refreshments served, so please ensure that you take something. Also to mention that for For those who came in with their cars, you'd have your parking ticket this way. You need to go to the registration desk to have it stamped. That would enable you go out safe and sound. So please just go to the registration desk with your parking ticket and go ahead before you leave the building. Also to say, please ensure you look around you to take every item you brought to the hall today. Your keys, your phones, your laptops, your bags, whatever it is, please ensure you have your items with you so we don't leave anyone behind. Yeah, that's the point. So please ensure you take everything that belongs to you out of here. Any other thing?
Thank you very much, Your Excellency, distinguished ladies and gentlemen. We want at this point finally to show our appreciation to every one of you, particularly our very special guests of honor, our development partners, and all those who come near and who came near and far for this occasion. Please may we rise for the national anthem.
Thank you very much. Enjoy the rest of your afternoon. My name is Inya Ode.
I remain Nuhuwane II. Thank you.
Enjoy your day. God bless.